This learning tool has been created to help you understand how 3M VAC therapy works and to clearly explain the proper and effective use of your ActiV.A.C system. To help you manage your wound, your healthcare professional has prescribed the 3M ActiV.A.C negative pressure wound therapy system for your care. With more than 10 million wounds treated worldwide and over 25 years of innovation, the 3M VAC therapy system delivers the proven clinical outcomes caregivers and patients can trust. Keep in mind, as with any medical device, it is important to review all instructions with your healthcare provider and make sure all safety information is understood prior to use. VAC therapy is a medical device system that creates an environment that promotes wound healing by delivering negative vacuum pressure to the wound through a patented dressing and therapy unit. This creates an environment that promotes the wound healing process. This negative pressure helps draw wound edges together while removing wound fluids and promoting tissue formation to fill the wound. Therefore, VAC therapy system is applied to promote wound healing, provide a moist wound healing environment, draw wound edges together, remove fluid and infectious materials, and minimize the need for daily dressing changes. In your kit, make sure you are provided a 3M ActiV.A.C therapy unit, VAC granufoam dressings, and 300 ml ActiV.A.C canisters. The VAC therapy system uses proprietary foam dressings, VAC granufoam and/or VAC white foam dressing with the therapy unit. Only VAC dressings are to be used with the VAC therapy units. Wounds treated with the VAC therapy system should be monitored on a regular basis by your clinicians who are responsible for treatment. The VAC dressing goes on or inside a wound. The wound area is sealed with the clear VAC drape with adhesive that helps maintain negative pressure over the wound. One end of the tubing connects to the dressing. The other end connects to the canister that fits into the therapy unit. It's recommended that VAC dressings be changed routinely every 48 to 72 hours, but not less than 3 times per week for non-infected wounds. If your wound is infected, your clinician will monitor your wound closely and may change your dressing more frequently. The 3M ActiV.A.C therapy unit is designed to provide you comfort and mobility. Let's become familiar with the components and features of your unit. Detailed information and references can be found in the documentation accompanying your 3M ActiV.A.C therapy unit. The important parts of your 3M ActiV.A.C therapy unit are the power on/off button, touchscreen user interface, power cord connection, and the 3M ActiV.A.C canister. To charge your 3M ActiV.A.C therapy unit, plug the AC power cord into the power supply. Plug the AC power plug into a wall outlet. Plug the charging cord connector securely into the unit. Press and hold the power on/off button for around 2 seconds to turn your 3M ActiV.A.C therapy unit on or off. On the touchscreen, you may see these displays and buttons. This button starts and stops 3M ActiV.A.C therapy. A lighted green crescent means the 3M ActiV.A.C therapy is on. It is vital your 3M ActiV.A.C therapy remains on for 22 hours of each 24-hour period in order to complete your wound healing process properly. If therapy is off more than 2 hours, the old dressing should be removed. A new dressing should be applied and 3M ActiV.A.C therapy restarted or replaced with a traditional dressing. Call your nurse or caregiver to perform this procedure. In order to silence alarms that do not require immediate attention, press audio pause for 60 seconds. Alarms requiring immediate attention cannot be silenced. Other displays on your touchscreen include audio pause indicator with countdown timer, battery level indicator, mode indicator with time and date, help button, therapy status bar, and screen guard. When you insert the ActiV.A.C therapy unit into the carrying case, make sure you can clearly see the touchscreen through the cutout window. You can use the tubing storage straps to discreetly keep excess tubing out of sight. Alarms occur if the therapy unit is not activated, if the canister is full, if the tubing is blocked, if the tubing or dressing has leaks, or if the battery is on low power. Refer to your device quick reference guide, located in the pocket of your carrying case, or your user ActiV.A.C Therapy information guide for instructions on dealing with a specific alarm. The 3M ActiV.A.C canister collects excess wound fluid to help with your wound healing process. To change the canister, stop therapy by pressing the on-off button on the touchscreen. Do not turn the power off to the 3M ActiV.A.C Therapy unit. Slide both tubing clamps towards the tubing connector. Hold both clamps tightly. You should hear several clicks. Compress, then twist to separate the tubing connectors. Press the canister latch release. Pull the canister directly away from the therapy unit. Install the new canister onto the therapy unit by sliding the canister over the canister latch guide until you hear an audible click. Compress, then twist to reconnect tubing connectors, opening both tubing clamps. Canisters must be discarded according to appropriate regulations. Please refer to the instructions provided to you by your healthcare provider, or contact 3M at 1-800-275-4524. Contact your healthcare provider with any medical questions, or if you are having any adverse effects. In case of an emergency, immediately call 911. Once 3M therapy is prescribed, for questions about 3M ActiV.A.C Therapy System operation, call 1-800-275-4524. Thank you for watching. We hope you have a better understanding and comfort with the 3M ActiV.A.C Therapy System.